Okay, all right. We are live. What's going on, y'all? Good evening. Good evening. Yours truly, Dr. Pierre. Thank you for joining. Thank you for joining, hitting the likes, hitting the shares. If you are on Team Podcasts and you happen to catch this later, shout out to you as well. Make sure you are subscribed to the podcast. Make sure, remember, this will be on our YouTube channel tomorrow. Yeah, it'll be on our YouTube channel tomorrow, so you can always check that out as well. Appreciate you joining. Appreciate you for joining. Tonight we're just having a regular. This is just a random. This is a random chat. We're not going to be talking about any specific topic. Now, if something come through, if something pops up, then we'll talk about it. But this really isn't something specific. Reason being is that it's been about a month. Like, in fact, it's been definitely about over a month. Since we did our lives. We typically do these things every Thursday, either evenings, afternoon. We typically do them on these Thursdays, but it got crazy busy. This month has been real busy, and not even from I have a look, because it's not even from a medicine perspective, which is, of course, I'm looking for stuff. Not even from a medicine perspective. We've been doing a lot of things, especially if this is your first time catching me. Those who may not know, Dr. Pierre, board certified internist. I see patients in a hospital, in rehab facilities, long-term care facilities. And we get on here weekly to just kind of kick some health knowledge or update my audience on kind of what's going down. If you are one of my YouTubers or my podcasters, we've been doing content over there. I don't want to say neglecting TikTok. I don't want to say we've been neglecting TikTok. It's been there. I've been in the shadows. I've been double tapping in the shadows, but nothing specific. We've had some great conversations over the past few weeks. We talked about what is this? Okay. All right. That's crazy. That's weird. That's so weird. So we were talking about firing your doctor, right? Thank you for joining. Make sure you hit the likes. Make sure you double tapping with the hearts. Appreciate you. We talked about when to fire your doctor, right? Very important conversation. If you don't know when to fire your doctor, why you would even need to fire your doctor, we got an episode for that. We talked about, especially for a lot of my patients, when trying to decide like what type of insurance, because we're going to get close to that time. We talked about that as well. Unless you're living under a rock, election season is going down. Unless you're living under a rock, election season is going down. And what does that mean? That means that we got some politicians who are going to be making decisions on your behalf. My behalf as well, but definitely your behalf. Your behalf being the person who's likely going to be affected. And it's going to be extremely important to be as educated as possible, regardless of what side you're on, right? It's going to be extremely important to be as educated as possible, because these decisions, whether it's for president, whether it's for your senator, whether it's for your local county commissioner, because I think a lot of people kind of slip on that. Like, I think a lot of people kind of slip on the fact that, yes, the president is big. The president is big. But your local city commissioner can cause you some headaches if you put the wrong one in there. If you put the wrong school board supervisor, attendant, whatever that position is there, they can cause you and your kids some headaches. So I think it's extremely important for us to be very, very educated with the fact that, these elections are here right now. Again, if you've been following me long enough, you already know what side I'm rocking with. One, right, because I'm a healthcare professional who takes care of patients, who understands, especially when we talk about like the Affordable Care Act, aka some of y'all might know it as Obamacare, recognizing that a lot of my patients would not have insurance without that. In fact, I don't know if people realize a lot of people would not have insurance without that. When it comes to women's rights, right? Like, I think they should be making their own decision. Like, I don't think someone, who sits in an office at a Capitol should be making that decision for them, right? So my position is pretty strong, right, of who we need to rock with. So I want you guys to recognize that it's extremely important. It is extremely important, especially with the way some of our branches of government have been doing to understand that this is going to be an important election. This is, we don't need to sugarcoat that. This is going to be an important election. And as a healthcare professional, as a doctor, and I actually talk about this next week. I'm doing an episode next week on the podcast and YouTube show where I just talked about the importance of your doctors talking about politics. I know a lot of doctors try to run away from it. I know a lot of doctors are scared to talk about it because they're afraid, they may lose a patient or two. Cool. Thankfully, I work in a hospital and I work in centers where the patients come to me. I don't have to go and get a patient. So that's not a big fear of mine. But even if I was in an outpatient practice, because I used to do outpatient medicine, even if I was in an outpatient practice, and my patients know, because I used to do it for about 3 years. 4 years. My patients know that I have no problem letting them know, like, hey, like this person you think you're going to vote for is going to cause you some problems down the line. So extremely important to understand. We got a lot of important decisions to make coming up with these elections. And I just saw a press release that kind of confirmed what side I got to rock on, right? Like they want to get anyone who wants to get rid of the Affordable Care Act is a dangerous person to me, especially when they don't talk about a replacement. Like if you don't talk about what you're going to replace it with, that's very dangerous. And it's scary because I know that if you got rid of the Affordable Care Act plan today, millions of people would be without insurance, would be out medications, would be without their treatments, cancer treatments, surgical treatments, millions of patients just overnight. Like that would happen immediately. And then we would see the downwind effects of all of these people who don't have insurance, who all of a sudden stop going to their doctor, stop getting regular checkups, stop making sure that, they don't have breast cancer with their screening mammograms, stop making sure that they don't have colon cancer. And then we would see the deaths slowly pile up with people who used to be able to get preventative care, who can't get preventative care no more, who used to be able to get routine screenings, who can't get those routine screenings, who used to be able to get their medications, who now end up in the hospital because they had a stroke and a heart attack, right? Like that's a problem for me. So if you are against that, that's a line in the sand that I typically have to draw, which is, again, it's wild. There's a lot of people who say that they're okay canceling it. I think just for the votes, right? Because in theory, it sounds good that you want to get rid of it. But in practicality, the likelihood of you getting rid of it and not seeing millions of people affected almost immediately is so like that I just can't fathom that you would do it. But I've seen in this country that our country is willing to do some stuff that I probably wouldn't have fathomed that it would have done. So again, that's just, neither here or there. Just understand we got to be quick with our information, right? There's going to be some wild scenes kind of happening over this next, I think it's like 100 days. Over this next 100 days, there's going to be some crazier things happening that we need to be aware of. So let's just get caught up, right? We got some things to, again, I'm just getting caught up because like I said, I have not done this in about a month. I apologize. I just asked what we're talking about. So this random discussion or chat tonight is more just kind of shooting the breeze. If there's any questions, any concerns, I'm an internist. So if you got any questions that an internist could be able to answer, a hospitalist physician that you want to answer, I'm pretty knowledgeable of that. But if not, I'll tell you, like, hey, I don't know that. And I'll tell you what I do know. But I was just kind of rambling with the fact that we do have elections coming up in the next 100 days. And it's important for people to be educated on how politics and healthcare are directly connected. And I get on my doctor friends all the time. Yes, internist is primary care. It's funny because we're actually in that kind of umbrella because typically because someone asks a question, can internist be primary care? Jesse, thank you for the question. Can an internist be primary care? The answer is yes. And when we think about primary care, it's usually 3 umbrellas. It's usually the internist, and I'm the person who typically sees a person 18 and older, right? 18 until you die is typically the internist physician. Family physician, shout out to my family physicians out there. They see them from like babies till they die. Like family physicians, I don't know how they do it. More power to them. Good luck to them. My pediatricians are my 18 and under, and my obstetricians, which for some reason doesn't get really put in the primary care category. But if you talk to plenty of women, you understand that most women, I don't want to say most, a lot of women will see their OB for a lot of their primary care issues. Like their OB is their main doctor for handling all of these things there. It's extremely common. So I always like to include the OB in primary care, even though the OB are just as much surgeons as they are primary care. Like they get the best, I think they get the best of both worlds, because they get to do primary care medicine a lot of the times, but they also get to do a lot of surgery. So they get the best of both worlds. I'm an internist. You don't want me near no operating room. Like that was cool when I was a medical student. It was cool when I was a medical student to do the first assist. That's what they call it. It was cool to do that. But the second I got out of my surgery rotation, I told my surgeon, hey, I'm not coming back because I don't want to cut nobody. It's not like I'm squeamish about blood or anything. I just don't want to be sitting in an OR room having to like hyper focus on one person. Like I just can't process information like that. I got to do a million things, which is why I think I like doing internal medicine, because I'm able to have different modalities and different disease processes that come all in the same day. So I can touch GI related issues, cardiac related issues, kidney related issues, lung related issues, all in the same day. And when it gets too specialized, I send it to my subspecialist. How do I find a good internist? I think it's a very good question. I think it's so funny because we actually did an episode on how to fire a doctor, but more importantly, like how do I find a good one? I think, in fact, you know what, Jesse? I appreciate you, right? Because now I'm gonna do an episode on that. Because I did a whole episode on firing a doctor, aka getting rid of your doctor, but I should do one on how to find a good one. What I would always say, especially as if I'm a patient and I'm just trying to find a good internist, one, I think it always starts out with word of mouth. I think word of mouth is a good indicator, like being able to get almost like a recommendation or a cosign. Getting that cosign from a friend, a family member to say, hey, you know what, I'm looking for a new doctor. What do you think about your doctor? What do you think about your doctor? And then they'll be able to kind of give you, their honest opinion. Now, what typically happens, and this is what I always counsel my patients, is that you can have one person who let's say someone sees me and they love me. They love everything about me. They say I'm the best doctor they've ever had. But then you could have someone else come to my same office and they hate my guts. And you might be trying to figure out, like, why did that happen? Like, how is it that one person can absolutely love this doctor, but another patient come through and they can't stand this doctor? And what typically occurs, and I always call this kind of the doctor-patient mismatch, because in that doctor-patient relationship, okay, sorry about that. When I put my hands together, a heart comes out. In this doctor-patient relationship, there are essentially three types of relationships for a doctor and patient. And, to be as simple as possible, you have your doctor who says, hey, you know what, I want you to, jump 2 times. And you have patients who are, okay, hey, the doctor told me to jump a couple times. I'm about to jump a couple times. I don't know why he told me to jump. I'm just going to jump. And you have patients who that type of relationship, they're very cool with. Then you could have another patient where I say, hey, jump 2 times. And that patient's like, okay, but like, why do I need to jump? Like, what's going on with the jump? Like, what happens after I jump, right? And then there's like a little discussion on, the jump. And then, they eventually say, okay, all right, you convinced me. All right, I'm ready to jump. And then you have that third patient. And these patients get a bad rap. I don't know why, but these patients get a bad rap. We call them like the Dr. Google patients, because these are the patients where if I say, hey, jump, they're like, hey, doc, yeah, I hear you told me to jump. But I read somewhere, like, in fact, I was on Dr. Pierre's live, and he said that, jumping 1 foot is much better than jumping 2 foot. And I got some research here. Hey, doc, I want you to read this. and let's come to an agreement on which type of jumping I should do, because I don't know if I should jump 2 times, right? So that's one of those relationships where I can't just tell that person to just do something, because they're going to have a million different questions. They're not trying to hear that. So one, trying to find, that match of like, what type of doctor, what type of patient am I? Am I the type of patient who is okay with the doctor just telling them to do something and then they go do it? Am I the type of patient who, if the doctor tells me to do something, aka take a medication, aka go get a test, do I ask a couple questions first and then I go and do it? Or am I the type of patient that when the doctor tells me to do something, I'm gonna bring back like 10, resource articles to say like, yeah, but maybe let's think about this option here. So just kind of understanding what type of patient you are, and then having those conversations with the doctor that you're going to try to introduce yourself with, I think is extremely important, because that will help guide you to have, a great relationship with your office, right? With whoever you're going to be seeing. So that would be the big thing for me. Word of mouth from friends, word of mouth from family members. Even other doctors, like let's say if you go to another doctor and you just like, hey, do you know any good internists? Doctors will definitely do a good job recommending you to other good ones, like, because they kind of know you from that perspective there. I think that's the easiest. It's very random to, look at, your insurance, and then you just see a random Dr. Barry Pierre, and you don't know what this guy does. Like, okay, I'm gonna call his office, I'm gonna try him out. It's very random, right? And very rare that, like, let's say my name popped up, right, in your insurance plan or card or whatever, and you say, all right, I'm gonna just Google this guy. I don't know what this guy does. I'm gonna just Google him, and then you just see like, oh wow, this guy does lives. He has a podcast. He has a YouTube channel. He has all these other things here. He's always educating. It's very rare that you're going to run into internists who are very active online, or just physicians in general who are just active online. It's very rare that you're going to run into that. And that's okay, right? Again, I'm trying to get a lot more of my colleagues online, but, they're scary. So if you do happen to get that one, then you can kind of get, you can break the ice a little bit earlier, right? Like, hey, I've seen enough of this guy's lives. I've seen enough of this guy's, YouTube shows to, like, I think he knows what he's talking about. Because he knows what he's talking about. All right, I'm going to go see him, right? It just becomes this guessing game, but I think it's important to go in it with the right mindset. Like, hey, this is what I'm looking for. This is the type of, doctor I'm looking for. And you kind of know quickly whether that person kind of meshes one way or the other. I think that's probably the easiest way to do it as far as kind of finding a good doctor, right? Oh, Anna, thank you. I appreciate the hearts. Love it. Love it. Great question. Great question. How do I find an internist, and really in general, how do I find a good doctor? Because there's a lot of us out here, right? Well, let me take that back. Depending on where you stay at. I stay in South Florida. I'm in South Florida. So you could throw a rock and you'll hit another doctor's office. But I know that, especially one of the reasons why I get online and do these things is because there are a lot of people who may not have that opportunity to, be able to ask a doctor a question, or may not have the opportunity to have, a doctor office down the street, right? Like, it may be a lot difficult for them to reach out to their healthcare provider, right? So it's just important to understand from an availability perspective. I'm sorry about that. Just important to understand from availability perspective, how you can get to that point. I think it's extremely important, but very, very good question here. Like I said, and it was one of those points I'm looking now because I'm just kind of going back on my episodes we did this past month. Like I said, we talked about firing a doctor, insurance, choosing the right insurance, and understanding why you chose the right insurance. Extremely important. Especially as you get older and you have to start thinking about things like deductibles and out of pocket cost and out of network physicians, and these are just things that, again, even when I had to go and get my own insurance, I wasn't really privy to. I just wanted to know how much I got to pay every single month. That was my only question. How much I got to pay every month? Okay, cool. That's the lowest. Cool. Not realizing that when I needed a test, when I needed a procedure, when I needed the actual insurance company to actually start paying, the physicians and the image centers and all that, it became a problem because I didn't understand the process of insurance. So very good question there. I even gave like a doomsday scenario if they took away Affordable Care Act plan. We talked about that earlier last month as well too. So we had some great conversations on like that doomsday scenario. Again, do I think it's possible? I would love to say 100% no. I would love to say 100% no, only because I know how catastrophic that would be. But with some of the politicians that we have here, and how confident they keep saying they want to repeal. And you got a Supreme Court that just kind of does what it does. It could be very concerning that could be a possibility for sure. Very concerning. Let me make sure I got that. No, I'm just checking to make sure we're caught up, right? So again, if we have any questions, let me know if there's any questions that you guys may have. Like I said, that was a very good question, very good, nice little segue too. To touch base on what we've been doing. And the question I always get, especially on my lives, what's going on with COVID? COVID has never went anyway. It never went anywhere, right? I always tell, and it's never going anywhere. Like COVID's here to stay, not going anywhere, here to stay. Yes, have we had a rise in cases? Yeah, we've had a rise in cases. We've had a rise in emergency room visits. I'm seeing more COVID cases in my rehab facilities. I'm seeing more COVID cases in my long-term care facilities. I'm seeing more COVID cases there. But which is important, what we're not seeing is people being hospitalized for it. So we're not seeing a lot of people who need to end up in the hospital because of COVID, thankfully, right? Like I said, we did a good job with the vaccines and boost. We still got to keep doing it. Still got to keep going. Especially because I think there's a new vaccine coming up in August, so it's still here. But yes, the cases are rising, and it's the summertime. Like, if you want to know why are they rising, it's summer. Like, that's really short of it. COVID has two periods where we may hear about it in the news: summer and winter. Winter is typically worse, but summer is still an issue, especially because it's usually the only player during the summertime. Because flu, we know about the flu. We know flu is usually that August, September, October, November, December. Like, flu is typically the winter time frame. But when it's summer, like, hey, this is all we got to talk about. Like, right now, we're not talking about RSV. We're not talking about the flu because it's not their season. Right now, the only thing we could talk about is COVID. So yes, COVID cases are rising. The ER visits are increasing, but thankfully, again, the most important caveat is hospitalizations. People being hospitalized for COVID is not rising. People who are dying from COVID is not rising. So which is probably, and if this is your first time watching, you'll hear me say this a lot. When we talk about COVID and COVID vaccines and benchmarks for success, the two markers I always look for is hospitalizations and deaths. Is that going down? And the answer is yes, right? So those are staying flat. They're still here because yes, people are still dying from COVID. Yes, people are still being hospitalized from COVID, but it's not as nowhere near where it used to be when we were under emergency pandemic status. Thank God for those who were able to mask, social distance, vaccinate, boost, all that. Thank you for everyone who did that, because that's why we're here today. So definitely important, and it is a conversation that typically happens during the summer, and I typically will start getting more DMs because it'll start popping up more on your news stations, especially during the summer. Why does it happen during the summer? I don't know about y'all, but a lot of us are traveling during the summer. A lot of, especially if you have kids aren't in school, so you're traveling more. You are, gathering inside more. You're going to places more. So it just is what it is, right? Same thing happens in the winter, right? We get to traveling around winter break. We get to traveling around the holidays, and it just becomes a place where, hey, now, COVID is here. Again, typically winter, we're thinking about RSV, COVID, and the flu. But in the summertime, it's all about COVID. And variant-wise, I think we have two primary variants happening right now. They're all under the Omicron umbrella. Again, not really as important. For my patients, for people who follow me, I always try to give you just as what's important for you. If you, for some reason, really want to know what the variant that's causing these cases, I could tell you, but not really important. Just understand that it's not as deadly. Yes, it's still transmissible. Yes, you can pass it to still people, but it's not as deadly, which is why we're getting, we're not seeing a rise in hospitalizations, or we're not seeing the rise in deaths. So that always an important conversation started here. Typically, when we do these lives, and if I do a live that's primarily centered on COVID, the chat is very different, y'all. The chat is very different. I don't know what happens. I happen to have a lot. I happen to have a lot of. I hate to call it hate followers, but I have a lot of people who follow me that when we talk about COVID, oh man, they can't wait to spam my comments. Oh my God, the vaccine, big. Oh, you're bought out. Dr. Pierre is bought out. Like we love them, right? I can't do nothing about that, right? But they latch on. So that's why I like when we do the non, fewer at risk, but a lot of high risk people are now. Oh yeah. Oh, see, I like that, right? Let me pin that, because that's a very good point. Very good point here, right? So in Sketchin, I don't even know. I'm not even gonna try to pronounce it because I apologize. I'm bad at that. Fewer deaths because a lot of our highest risk people are dead. Yeah, that's true too, right? There are a lot of high risk people who have already passed away. There are Sketchy can. Okay, all right, that's not difficult. Sketchy can. Our highest risk patients. They passed away. A lot of our non-vaccinated folks, they passed away. We have vaccinated folks who passed away too, right? Because I already know that's going to hop in the comments. But like a lot of people, and especially when we talk about COVID in this instance, we have to remember we're survivors. It may be sad to say it out loud, but we survived a pandemic. We survived that pandemic. And so it's easier for us to kind of talk about COVID in a different light because we happen to survive the Delta variant. We happen to survive the worst of the Omicron variant. We survived a lot of those significant deadly variants that killed a lot of people. And thankfully, because we survived, because there's vaccines, because there's boosts, because there is masks, because there's social distance, we are here today to kind of just say, all right, guys, summer, winter, COVID rise, be careful. Like, we're okay to do that, but we do have to remember, and I love that you said that, we do have to remember that a lot of people did not have the opportunity to get to where we can be like, all right, just another COVID boost. Like, be careful, right? Extremely, extremely important here. Let me see. Rachel says, lost my mom because misdiagnosed upper respiratory was actually COVID. Yeah, no, that's extremely important. First of all, my condolences to you and your family. But that is such an issue because we know COVID just isn't, and that's why I make sure to highlight, like, yes, people are still dying from COVID. COVID is not a regular disease. It was not a regular disease. It's never been a regular, respiratory disease as they might have tried to portray it. And there were a lot of people who, especially depending on the type of variant, may treat it one way and not give it its full credence that you need to treat it, and then you miss a window. You miss that window where you could have been aggressive, and then issues happen. There again, because I'm a hospitalist, so I took care of in my hospital. I took care of the very first patient who had COVID, and there was a time where we couldn't even, like, for us to test that you were positive for COVID, we had to leave you isolated for like 3 days. Like, now I can go to CVS, boom, I got COVID. Like, so a lot of people don't, because again, there's more as the survivor bias that we have. A lot of people really don't remember how bad it was at the time that it was. And Rachel said a great thing, and I'm gonna talk about that too, because I got to talk about I got to get on my physicians for a little bit. A lot of people don't remember just how bad COVID was when COVID was doing what COVID was doing. So when we fast forward here, some people, especially those who are like anti-vax or whatever, can make will make light of it as if they aren't lucky as hell to be with us. And this is the point. Rachel said it was last summer, right? So this is recent, and doctors didn't test for it. And I'm seeing a lot of my colleagues do this. I'm seeing, and again, more of a survivorship bias, where we are letting our guards down, where we're just like, it's not as bad anymore. So we're allowing, again, we allow a patient who has some upper respiratory issues, and we don't even think about COVID. There was a time where if you came in with anything in the hospital, I'm testing you for COVID. Like, you come in for stub toe, my foot hurts, I cut myself, like I hit my head. Let me check to make sure you got COVID. Like that, there was a time. That time is not now. And there are a lot of people who get admitted to the hospital and they have to do a procedure. And because of the procedure, the surgeon wants to know, or the anesthesiologist wants to know, like, hey, do you have the COVID? Let me check to make sure they all got COVID. And then they find out they have COVID. And this patient has been there for 2-3 days, quite often. So I think that is a point. And I love that Rachel kind of mentioned it, especially for my healthcare colleagues, that we can't be the ones to let our guard down when we think about COVID-19, especially during the summer, right? When we know that it's the only game in town. It is the only game in town. We can't be the ones to let our guard down and act like this is not an issue that should always be at the front of our minds, because it's extremely important. Like I said, I work in rehabs too. You can't send a patient to the rehab without us knowing whether they have COVID or not, right? We still do that, right? Because we don't want no one slipping. We don't care what they did in the hospital, but we still want to make sure that they don't have COVID. So extremely important to understand, right? Yeah. So they're calling it the summer cold. No one wants to know, and it's weird too, because no one even wants to know that they have COVID. It's just scary. All right, I got a COVID, but I'm gonna fight through it. Oh, you might have COVID. Nah, I'm cool. I don't want to get tested. They don't want to get tested. If you ever been tested, oh, hey, Corey, how you doing? If you ever been tested, it's not a pleasant test. It ain't a pleasant test. If you ever been tested for the flu or COVID, these ain't pleasant tests to have. So I'm not gonna front and act like it's a pleasant test to have. But it is a test that if you are in a healthcare setting and your patients are coming in with especially anything respiratory, there's literally no reason why you're not testing. I don't understand why you don't test. There's really no reason why you're not testing for these things. It just is what it is. Alternative. Tell me what you mean by the alternative, Tiger. Tell me what you mean by the alternative. Yep. Yeah, and Dola said some healthy people died too. Yeah, and I think that's the thing too. It's one of these when we think about, and this is more when we have our conversation about ways to protect ourselves, because I know obviously one of the more popularized ways is getting vaccinated, which I am champion vaccine. But you'll have people say, oh, well, why should I get vaccinated? It doesn't 100% protect you. And I always say, yes, a seatbelt doesn't 100% protect you from getting hurt in an accident, but I'd rather have the seatbelt, right? I much rather would have the seatbelt. So I understand why there's some, hesitation, some concern. Of course, especially during the pandemic time frame, those who are really against the vaccine would make up lies about how we were being injected with 5G, and we were changing our DNA, and just random lie after lie to try to get us from not getting vaccinated. Some people said that we'd be walking zombies by this time period. Of course, there's not billions of people who are walking zombies right now, so that's not the case either from that perspective. But it is one of those things where, yes, a healthy person can definitely have COVID, and it really just kind of underscores just how important COVID is. And how significant and serious it still can be. That you can be in, year 2024, 2023, and still have people who are passing away because of how severe it is, right? This is very severe disease. It's a very severe inflammatory disease that attacks the lungs, kidneys, and can shut down your body, right? It just is what it is. Thankfully, we do have medications that you can take outpatient We got pills that you could take. Obviously, you can get vaccinated. We got IV medications in the hospital that you can take to try to decrease inflammation. So we do have options available, but it is important to understand that yes, you can be the healthiest person, you can be the sickest person, and still kind of succumb to that process there. Yeah, COVID tests are very uncomfortable. No, definitely true. No, COVID, like, yeah, if you've ever had a COVID test, I mean, those people will stick that little cotton tip all the way in the back. I almost feel like it's hitting your brain to try to test for it, right? Like I always tell them they gotta find a better way to like test for that more than anything else, because that is a very uncomfortable approach. But yeah, I would much rather know if I got COVID or not. That way I can treat it, yes or not, then deal with that discomfort or pain at last, right? And again, it's one of those things where, especially, we're in the year 2024 now. So I think the CDC, they're not even like calling it boosters anymore. They're essentially, especially when we get new ones, they're going to say the new vaccine. Hey, new COVID vaccine's coming up, right? I think they're trying to get away from the word booster. I think booster has, for some people, have a negative connotation, like, oh, the first one didn't work. So they're essentially adopting the same language that we do with the flu, right? And this, again, for every time we get a flu shot, every year, if you get flu shots, if you get a flu shot every year, it's a different type of flu vaccine. We don't call it a flu booster every single year. We just say, hey, it's time for your flu shot. So I think they're going in that, they're having that same terminology and that same language for the COVID vaccine. So I think they're going to start calling it the COVID vaccine. Like, hey, it's time for your COVID shot. Hey, it's time for your 2024 COVID shot. Couldn't get it. And yes, it will be different to try to catch up with the variants that have been causing problems within the past year, which is typically how the flu works. Flu says, hey, you know what? All of these variants caused a problem this past year. So this year I'm going to make a flu vaccine for that. And then they look back and say, all right, boom, all these variants cause a problem. Let me make a vaccine for that. So I think you'll see that happen in that same kind of ilk as far as treatment coming forward. And again, August, it's either August, September will be the same time frame, because I think they try to do it at the same time frame as the flu. So you can just go ahead and get your flu COVID vaccine at the same time and then knock it out. And yes, you can get both those at the same time with no problems there. And so this month we're gonna have some good conversations because I'm just looking at my list. This month on our lives, we got to talk about blood pressure, right? Still got to talk about blood pressure. Blood pressure is still causing a lot of problems. We got to talk about my mortal enemy, which I think is one of the worst diseases ever, diabetes, which may sound wild. I think diabetes is one of the worst diseases ever. We're going to talk about that this month. We're going to be talking about cholesterol. Always got to talk about cholesterol. We're going to be talking about breast cancer soon. Breast cancer awareness month is going to be coming up in a few. So we're going to have a great time. Great time for it, right? I just want to, again, appreciate everyone for joining the live. Like I said, we typically do this every Thursday. Usually do it Thursday evenings, but I've been experimenting and trying to do Thursday afternoons as well, just to see if there's a difference on people who check in. So we'll see. So I think next week we'll probably do a Thursday afternoon, just so we can kind of see if there's a difference there. And then we'll just kind of continue to grow. Make sure you follow the channel. If you didn't catch this episode, or if you don't catch any future lives, we do put this recording on our YouTube channel, and that typically happens the next day. So Friday it will be on our YouTube channel. And if you're a podcast listener, we actually take the audio and then we put it on the podcast. That usually happens on Saturday. Podcast is Lunch and Learn with Dr. Barry, and the YouTube channel is Dr. Barry Pierre TV. But if you go to my profile, you'll see the links for both. So y'all be blessed. Y'all have a great evening. I'm about to get up out of here. See y'all guys next week.